Well, we are well into cold and flu season in New Zealand with respiratory infections on the rise. Once something that heralded the beginning of the colder months, now the world of global travel means that we can come into contact with viruses or bacteria that are responsible for a respiratory infection at any time. Today I'm sharing what you can do to prepare for the onset of colds or flu. We're talking about how to prevent getting sick or sharing your germs around once you are sick, and how you can best take care of yourself when you do come down with something. Let's get started, shall we? Well, hello beautiful people, and welcome to the Project Joyful podcast. I'm your host, Tracy Tutty, your medical herbalist and high performance coach. So hey, Project Joyful isn't just about being happy. It's about consciously creating a life you love. It's about remembering how to reconnect with your soul-centered joy. You know, that joy that comes from doing what you love, from living on purpose, and from being in a life that allows you to experience deep joy moment by moment. So hey, let's get started, shall we? It used to be that autumn into winter heralded the rise in respiratory infections, but now with global travel, the chance of coming down with a cold can happen at any time of year. Whilst the COVID time was a painful time in many ways, it did demonstrate just how effective protocols for preventing respiratory illness can be. Whilst those were drastic measures, we can use the principles and adapt them for our everyday life to minimise the opportunities for contracting a respiratory illness. So before we get into the how-tos, let's talk about what exactly a respiratory infection is and when you absolutely must seek professional medical advice. Your respiratory system takes care of all things breathing related. It takes up oxygen from the air that we breathe, and on the out-breath it releases carbon dioxide. That's in its most simplest form, right? The organs of your respiratory system include your lungs, your nose, your trachea or windpipe, and the muscles that you use when you breathe. Yep, you really do use muscles. These are your intercostal muscles, which sit in between your ribs, and the other breathing muscle is your diaphragm. And this is why diaphragm breathing is so important to good respiratory health. Forget about that myth of having a flat tummy all the time. When you breathe properly, you'll notice that your belly expands on the in-breath, and that's a good thing. You want to be exercising all of those muscles and keeping them in shape. So when you breathe in, air moves in through your nose and also your mouth, if your mouth's open. It passes through your larynx, then down your trachea to your bronchi. And your bronchi and its friends further down the passage, your bronchioles, move air into your lungs, where gas exchange happens. Now I know it sounds complex, and it is. And well done your body for taking care of all this breathing business automatically without you needing to think about it. Okay, so stay with me. We've got one final piece of biology. So your lungs have sections or lobes within them. Your right lung has 3 lobes, unimaginatively called the upper, middle and lower lobes, and your left lung has just 2 lobes, upper and lower. And this is because for almost everybody, your heart is also in the left side of your chest area. When we talk about respiratory infections, we refer to 2 types. An upper respiratory tract infection, or URTI, is usually viral and it affects your nose, your sinus, your throat, also known as your pharynx, your voice box or larynx, and your airways. Respiratory infections are highly contagious, and they're spread through the air by coughing and sneezing, or when you touch a contaminated surface, and then, for example, touch your face, through saliva, so kissing or sharing drinks, or by touch, so mainly through a hug or a handshake. Most upper respiratory tract infections are more of an uncomfortable experience and don't tend to be life-threatening. With some loving self-care, they tend to resolve within 10 to 14 days. Lower respiratory tract infections, or LRTIs, can be more serious as they include pneumonia and acute bronchitis. And this is anything below your larynx, so your windpipe, but it's more commonly residing in your lung. An LRTI, lower respiratory tract infection, can be caused by a virus or by bacteria. Lower respiratory infections are the main reason for hospitalisations. In New Zealand, they account for around 600 hospitalisations per 100,000 people each year. And that's twice as many as the next most prevalent reason for being hospitalised, and that is, in New Zealand, well, it's skin and soft tissue trauma. Epidemiologists have reported that the level of hospitalisations in New Zealand dropped by half for pneumonia and influenza during the 2021 season, when we had the more extreme COVID prevention measures in place. Now, why is that? Remember how these infections spread? It can be airborne, so someone coughing or sneezing near you, touching contaminated surfaces, physical contact, or a saliva exchange. So the implementation of physical distancing, mask wearing, educating about appropriate hand washing protocols, and teaching us to cough into our elbow rather than our hand did that. So what does this learning mean for where we are today? Keeping up the hand washing protocol is a great start. Hold your hands under water that's as hot as you can comfortably handle and lubricate with soap for at least 30 seconds. Dry your hands with a clean towel or air dry them, so no wiping on your jeans, people. Minimise touching your face with your hands if you can as well. So when you feel unwell, if you can, isolate, stay at home, rest, keep hydrated, preferably with plenty of water or a cold and flu herbal tea. Make some to keep in the cupboard and use it when you come down with something. It's really easy. Just combine equal parts of yarrow, peppermint and elderflower. And then top it up with whatever you need in that moment. I like to add a tablespoon of kiwi herbs immune berry syrup, for example. It's a delicious syrup of echinacea, New Zealand blackberry, manuka honey and apple cider vinegar. And then make just like you make a brew. Also keep a stock of vitamin C, zinc and quercetin, and start taking that as soon as you feel something coming on. And vitamins D and K can be helpful too. Follow the example of our COVID-educated kids and cough into your elbow rather than your hand. It stops you spreading viruses by contaminating surfaces. So if you have something respiratory incubating, it means that you won't be touching door handles with something you've just coughed into. Discard used tissues immediately. Don't store them in your pocket or handbag to be sorted out later. Your first line of defense for you and your loved ones is creating a barrier so that you limit opportunities to share the respiratory love. Your next focus, and one that's more preventative, is to prioritize your respiratory health. Do things that give your lungs a workout, whether that's exercise where you're breathing deeply or breath work. Give your body the resources it needs to prepare and, if necessary, mount a defense. Keep those lung tissues nice and moist with an appropriate level of hydration. And use herbs such as ribwort plantain, which we talked about in the last episode, or panax ginseng if you get on well with it. Thyme or horehound are also really great respiratory herbs. When you notice an infection, reach for your anti-infectants like elderberry, elderflower, echinacea and thyme. Combine it with your garlic, your onion. NAC as a supplement is great. It's N-L-acetylcysteine and it's a powerful antioxidant that can thin excess mucus. So it can be really helpful during these times. And be aware, if you're exhausted from the effort of trying to breathe, your cold or flu hasn't improved after a week, or you have a cough that's persisting, or it just seems to be getting worse, or most importantly, if you ever cough up blood, seek professional medical advice so that we can layer in whatever you need most in that moment. It's going to speed up your recovery. You see, there's nothing heroic about going into work when you're sick. Pushing through will prolong your cold or flu, and in some cases it can open the door to something more serious, such as a secondary infection. Trust me, you're not being lazy by choosing to prioritize yourself and staying in bed and resting. Resting and recovering is hard work. So if you find yourself succumbing to a cold or flu, be gentle with yourself, rest up, and ensure that you recover completely. Sending you lots of love. Bye for now. Hey, thanks for listening to today's podcast. Can I ask you a favour? If our conversation spoke to you today, could you please take a moment to leave a 5-star review? Your review will help people discover this podcast, and together we can create a world where there's even more love and more laughter. And if you want to hear more from the Project Joyful podcast, just click the subscribe button. Bye for now.